Marley Drug.
Hi, my name is Monica and I'm a pharmacist who works with Marley Drug Pharmacy. Today we're going to talk about Xarelto, also known as Rivaroxaban. This medication has been widely prescribed for years to lower your risk of blood clots that can lead to serious conditions such as strokes, deep vein thrombosis, and pulmonary embolism. Recently, the FDA approved the first generic version of Xarelto, which means more patients may have access to a lower cost alternative. But what exactly does this medication do? How does it work? And what should you expect if you've been prescribed it? Let's go over everything you need to know. Xarelto is a prescription anticoagulant or blood thinner that helps prevent dangerous blood clots from forming in your body. It belongs to a group of medications called direct oral anticoagulants or DOACs. Unlike older blood thinners, which affect multiple clotting factors, Xarelto specifically targets factor Xa, a protein that plays a key role in the blood clotting process. By blocking factor Xa, Xarelto slows down clot formation, reducing your risk of blockages that could cause life-threatening complications. Doctors prescribe Xarelto for a variety of conditions in both adults and children. For adults, it's commonly used to lower your risk of stroke in patients with atrial fibrillation that is not caused by a heart valve issue. Xarelto is also used to treat and prevent deep vein thrombosis and pulmonary embolism. Xarelto is prescribed for patients who have had DVT or PE and need continued treatment to prevent future clots after completing at least 6 months of blood clot therapy. Another common use of Xarelto is clot prevention after hip or knee replacement surgery. When patients undergo major surgeries, especially joint replacements, their movement is often limited during recovery, which can increase the risk of blood clots. Xarelto helps prevent clot formation in the legs and lungs during this recovery period. Similarly, for hospitalized patients with limited mobility due to an acute illness, Xarelto may be prescribed to prevent blood clots during and after their hospital stay. Beyond clot prevention, Xarelto is also used to lower your risk of major heart-related events in patients with coronary artery disease or peripheral artery disease. In these cases, Xarelto is prescribed alongside low-dose aspirin to help reduce these risks. Xarelto is also approved for use in children who need blood clot prevention. Children from birth to under 18 years old may receive Xarelto to treat existing blood clots or prevent new ones after completing at least 5 days of injectable or intravenous anticoagulant therapy. Children aged 2 and older with congenital heart disease may be prescribed Xarelto after undergoing the Fontan procedure, a type of surgery that improves blood flow in certain heart conditions. Xarelto is generally well tolerated, but as with any medication, there are potential side effects. Common side effects include mild bruising, nosebleeds, nausea, headaches, or dizziness. In children, additional side effects may include vomiting, cough, and stomach inflammation. While these symptoms are usually mild, contact your doctor if they become severe or persistent. More serious side effects include an increased risk of bleeding, as Xarelto prevents normal clotting. Minor bleeding, such as mild bruising, may not be concerning, but excessive bleeding requires immediate medical attention. Signs of serious bleeding include uncontrollable nosebleeds, heavy menstrual bleeding, coughing up blood, or black tar-like stools. Another serious risk is the development of spinal or epidural blood clots in patients undergoing spinal procedures. Symptoms such as severe back pain, numbness, or tingling in the legs or muscle weakness requires immediate medical care. One of the biggest concerns with Xarelto is stopping it suddenly. Doing so can increase your risk of stroke. If you need to stop taking this medication, your doctor may transition you to another anticoagulant to maintain clot prevention. Xarelto can also interact with other medications, increasing your risk of bleeding. Drugs such as aspirin, NSAIDs like ibuprofen and naproxen, warfarin, and certain antidepressants can heighten bleeding risk when taken with Xarelto. Xarelto is an important medication for preventing dangerous blood clots, but it must be taken exactly as prescribed. If you ever have concerns about your dosage, potential side effects, or missed doses, reach out to your doctor for guidance. And remember, never stop taking Xarelto without medical supervision. If you'd like to learn more about Xarelto, check out the links below for more information. Feel free to ask your doctor any questions or drop them in the comments below, and don't forget to subscribe. Bye for now.